Thank you so much, my colleague Crystal Panda. Those of you joining us for this conversation are from Action for Health in Lubowa. We want to welcome you, those joining this conversation. It's what we call the third summit of RMNCAH. RMNCAH could be termed as, that's an abbreviation, but those joining the conversation, it's reproductive, maternal, newborn, child, and adolescent health. It's the third summit. My name is Andrew Chamagero, and we are live from the Imperial Hotel here in Kampala, and I'm working today with the beautiful, multi-talented Kemigisha Elizabeth. Elizabeth, good to have you again.
It's good to see you again, Andrew. Yes.
Today we've had a lot of conversations. What do you make of the youth today in our country, for starters?
We could start with the statistics. Like I was telling you earlier, every time I see the statistics, I'm thinking, okay, I am not under 15.
Okay.
I am not under 24, and there are so many under that age.
Oh, yes.
What does that mean for us who are above, 24? When we see 50% being under 15, and then we have 72% of Ugandans under 24. And that is not me and not you.
Oh, yes.
Where are they?
That is the question, and that's what this summit is entirely about. The third Youth Engagement Summit, it's therefore about sharing the evidence. But before we start this conversation, the second summit, there were commitments that were made from the stakeholders. That was the government, the CSOs, the peer educators, and other NGOs working with us. If we could start with Elizabeth, what was the first commitment in the last summit we had?
Okay, so the last commitments, we had young people committing to work with all relevant sectors, including districts, government line ministries, private sector, and non-profit organizations to amplify voices of young people and design solutions to their various challenges.
Well, and the second one was scaling up the peer-to-peer approach as a mechanism of advocacy and accountability, sharing, learning, and linking young people to comprehensive SRH and youth-friendly services. This was the second commitment in the last summit.
The third commitment was to intensify the use of innovations and technologies for awareness creation on RMNCAH among the youth, adolescents, for increased demand and utilization of health services.
And the fourth one was advocating for inclusion of all vulnerable and marginalized adolescents and the youth, including those with special needs and the disabled, to level the ground for their rights, especially for RMNCAH. That is something I've tried to see at the different levels being amplified in a way. And the last one was?
Yes, the last one, which is the fifth, is to strengthen and build partnerships among youth-serving, youth-led organizations to ensure coordination and increase impact of the RMNCAH efforts.
Well, that is the conversation we are having. Those joining us from the TV, we are live on NTV and on the YouTube channel, of course, of Nagro Teenage Center and the one of NTV Uganda. Be a part of this conversation on Twitter and on Instagram and on Facebook. The hashtag is RMNCAH. I'll spell for you RMNCAH. For those of you who are watching from home, it's capital RMNCAH. That's the hashtag. And then we can have the conversation going. Now, to bring this to much more start of today, we have remarkable people who are going to address the issues and dissect them to make sure that we achieve the bigger end of the third summit. To start off this conversation today, ladies and gentlemen, we're starting off with a keynote address from Professor Omaswa Francis, the ED at our chest. Ladies and gentlemen, the ones who are here with me and the ones at home, join me as we clap and we welcome Professor Omaswa Francis to give us the summit keynote address. Professor?
Yes, Andrew, while Professor gets ready, perhaps we could read out his profile.
Okay.
So, Professor Omaswa Francis is the Executive Director of African Center for Global Health and Social Transformation, which we all know as ACEST. an initiative incorporated in Uganda and promoted by a network of African and international leaders in health and development. Until May 2008, he was a special advisor to the WHO Director General and founding executive director of the Global Health Workforce Alliance. Before joining GHWA, Professor was the Director of Health Services in the Ministry of Health of Uganda, during which he was able to he was responsible for coordinating and implementing major reforms in the health sector. Some of you could remember the introduction of SWAP and quality assurance and decentralization.
Decentralization was my best because it brought the patients or the clients, like we prefer to call them, closer to the service providers. We're very gratified to have Professor Omaswa Francis, and he's going to address us. Please take note, whatever he's going to be highlighting in his submission, let's take note, because this is why we're having the third summit. It's entirely about sharing evidence and finding lasting solutions.
Yes. And more importantly, please share online what you pick out and what you find very interesting.
Oh, yes.
Wherever you are part of this conversation.
Professor is trying to align with the technology so as to give us much more of what we need. But please note that leveraging local government structures to address the persistent SRHR challenges and harnessing the opportunities that are there, the ones watching us and in the different hubs. I understand we have the hub in northern Uganda, we have the one in Lubowa, and wherever you're watching from, please be a part of this conversation and share your thoughts as and when they come through. Professor?
And I am very happy to see that the organizers also gave us folders with masks in them, because, my friends, let's take Corona seriously. Let's take Corona seriously. If we don't, we get into trouble. So now to our subject for today. It is about the youth and leveraging local government systems. Now, let's start about youth. Everybody knows this. We've just heard about this. We are the majority. Are we? Should I say we are the majority? You are the majority, because I'm not a youth. And unless this country, unless Africa takes the issue of the youth seriously, we are headed for big, big problems. We are headed for disasters. Africa is heading to become the most populated continent in the whole world. By 2050, most people will be here. But what are we doing to make sure that those young people become the demographic dividend that we all want to see? They become the force for transformation, and they become the future of an Africa that is a global leader. So the matter is very, very, very serious. And of course, the youth whom I know here in Uganda, there are two types. They are the youth like you, the urban, highly educated, high flyers. When I go to meetings like in the UN General Assembly, I find the Ugandan youth there also talking. I go to the TICAD meeting in Japan, I find Ugandan youth there. They are part of the leadership. and so on and so on. These are people like you. This is one group of youth. But also when I go to Ngora, that's where my home is, I find other youth there. Those ones who dropped out of primary school, maybe even secondary school, they have no skills, they are demoralized, they are living their own life in its own ways, and they are the vast majority. The systems, our systems, are not serving them. The quality of primary school education is a big, big issue. Huge classes, one teacher, demoralized teacher, inadequate teaching materials, and so on. And families and parents who are not following, they are not keen on what happens to the child when the child goes to school. The PTAs are not supporting schools. We have very, very, very big challenges. When I went to primary school, my class, we were 11 children in the class. Some of them were not children, actually. They were very big people. Now, the same building is there where I went to primary school with more than 100 children in the class. So we need to do something about this. And our solutions should be tailored for those two groups of youths. This group, like you, who are here, and then the other group who are in the rural areas, who now basically they live in groups of their own. They have to socialize, and they do things for themselves. They don't attend, like my young relatives. It's very hard to bring them to a clan meeting, even a family meeting. They don't see themselves as part of that. They feel let down. Nobody cares about them. So we have a crisis, particularly with that group of youth. If we don't deal with them, there will be problems. They are the ones in their groups. They also need money. When you put your solar panel outside your house, they will come at night, take it and sell it for their own social life. You've planted maybe fruit trees. They will come at night, harvest them, and go and sell them for their own social life. So we have a big, big youth crisis in the country. It's a crisis. So the topic is about how to harness central government. Let's talk about decentralization in this country. There is a legal framework. In 1997, there was the Decentralization Statute, which basically divided the service delivery into two categories: the central line ministries and the local governments. The central line ministries remained with 4 functions. These are policy setting, standard setting, resource mobilization, human resources for health, or human resources, and supervision. That is the central line ministry. But implementation of all services was decentralized to the local governments. All services were decentralized to the local government. And the local governments are there, multiplying very rapidly. From 39, when we started, to now 100 and something local governments, taking services nearer to the people. But I'm not sure if this is achieving its goals, taking services nearer to the service. So local governments are key. We need to talk about how to work with them. How to work with them, I will say, with other groups too. So now the government structures, governance structures at all levels, you know, you've got the president, cabinet, parliament, ministry of local government, and then each constituency, that's the county, there is a constituency forum, which is a political forum. It is there. It's a question of how much it is being used. We have district councils, sub-county council, parish councils, parish development committees, village councils, and planning committees, And they are supposed to work through participatory planning. The councils have 9, and the whole thing in Uganda here is actually very, very well designed. The design is excellent. Now it's a question of making it happen right. So this structure can reach every home with LC1 and the parish chief now, and so on. So if we really operationalize this, we will be able to achieve our goals. But apart from those government structures, there are also cultural and community structures, starting with the family and the households. That's also a big issue. Do we, as parents, take seriously the question of managing our homes, managing our children well, sending them to school, there's food at home, and so on, there's law and order, and all those things. Are we doing those? What are we doing to make sure that households, heads of households are accountable? Because that's where the children grow. And what they are made in early childhood, by the time a child is 5 years of age, probably their way forward is already determined. Their attitudes to life is already determined. And we also have communities, urban as well as rural, people together in one village and in a setting. They have cultural institutions. They are there also. They are still active in our communities, religious groups, and there are civil society organizations which are active in the districts and in the communities. So I'm giving you that list so that we are clear that the structures are there, and then we'll talk later about how to make them work for us. Then in the health sector, there are health structures. There is the National Health System, Cabinet, ministries, and the National Health System. Then there's the decentralized system with local government, which I've just told you. Don't forget the private sector. Private sector, not for profit. Private sector, so-called for profit. They don't like that name, but we don't have a better name. So they are there. They also are major service providers. And then there's the informal sector. Those drug shops which you find all over the place. Clinics which are opened by all types of people. When you go to the village, you find people are walking with needles. And they are getting injections. And they are not being prescribed by qualified people. There's plenty of that happening. We also must not forget traditional health practitioners. They are also still in business, and they are used by many people, and the development partners. Now, the health sector at the decentralized level has got standards or levels. There is level 1, which is the village health team. Level 2 is a health facility, physical, but I understand they are being abolished and all of them being lifted to Health Center 3. And Health Center 4, which is got capacities for, even doing cesarean sections, blood transfusion, and also all this. I visited some recently. They have youth-friendly clinics, youth-friendly centers, which clinics run during weekends. And one of the ones I visited, it even had games, Ludo, and this pool, and so on, cards, which is very good. And then we have hospitals, and so on. So the facilities are there. And each one of them has got what is called service standards, what that level of services it can provide. It includes services for youth, includes services for sexual and reproductive health, all of them. Maternal health, all of them. And it is then a question of why are they not working as we want them to work. I want to talk about what happens more in the communities, because that's where the majority of these youth live, the ones who are demoralized and are not being really taken care of. We have those, I described to you those parish, the parish council, the LC1 council, participatory planning, and so on. But on the health side, there is a village health team in the community system. And the original vision of this, 9 members, and one of them is a full-time community health worker who should be paid, but they are not paid. They are all volunteers, but still they are there. The community health worker in the village health team was designed to have a bicycle for moving around the village, a uniform so that they can be identified, a bag to carry their essential items for doing their work, maybe a thermometer and so on, and a register in that bag. This village health register is supposed to have a page for each household. So households in the village are numbered H1, 2, 3, 4, and each of them there is a page where the father is Omaswa, the wife is so-and-so, the children are so-and-so, the children immunized. This record should be there. That's the way it is designed. And I really would like to see that we are all familiar with this, and as we will talk about what to do, that you know that these structures are there. The Ministry of Gender, we are not talking much about them, but that's where youth are, isn't it? Where are they? What are we doing with them? What is their mandate? Are they funded? Why are they not funded if they are supposed to be funded? And some years ago, I saw they had developed a community mobilization and empowerment strategy around 2006. That's a very long time ago. But it is there. Maybe it has been updated. Maybe Dr. Abongomera, that was the guy's name. I think he passed away. He was the one who coordinated the development of that strategy. It's very important. Well, also at the higher level, at the Ministry of Health, everything is there. The policies are actually there. Policies are there, and they are very good policies. They address the needs of the youth. And then we are now talking about universal health coverage. Universal health coverage, if you really want to summarize it, is that years ago there was colonialism. Years ago there was something called apartheid. Years ago even slavery was there, and so on and so on and so on. But in 2015, chaired by Honorable Sam Kutesa here, President Museveni was also there. We were the chair of the UN General Assembly when they adopted SDGs. It was decided that certain things can no longer be tolerated, such as avoidable deaths, such as certain levels of infant mortality, maternal mortality, under 5. We were all given targets to achieve by 2030. So let's work in Uganda to achieve those targets so that nobody is left behind. And our structures are there. I've just told you about the village health register with the page. So everyone can be traced. In Uganda, we have structures which can achieve SDGs. It is now a question of how we make them happen. And also this universal health coverage is not really new. When I was growing up, in colonial days, the health services were free. and actually available also when you needed them. And that was going on even after I qualified and became a doctor. I went to practice up-country in one of those up-country hospitals. Everything was there and was working well. And the health indices in Uganda were the best in this region here. So it is something which we can go back to. It is something which we can go back to. But before we do that, let me just tell you about those colonial days. They are not, you know, we are not celebrating them, but there were some good things which were happening. That village health system, there was a chief in the village. They are still there. And what those chiefs did, just one man, he made sure that the rural road network was working. He made sure that immunization, those days it was just initially only smallpox. Eventually this normal immunization came. Even after independence, those things were working. They made sure that, you know, if a child was going to school and is playing truant, hiding, they would round them up and force them to school, attendance to antenatal clinics, and so on and so on. Children, law and order is maintained. That's very important. Law and order is very important, so that the whole, you can get up in the morning, go and do your things, and come back home safely. So there is a system in Uganda here which can make these things all happen. Just that it is not happening to scale or as much as, and that's what you people want to do in this summit. And in Uganda, we also what is called minimum health care package, basic package, which everyone should access, and those service standards. And at the moment, there are no user fees. The user fees were abolished, although people charge you when you go to the system. But again, here, funding for health has gone down per capita, has gone down, down, down. It needs to get better. And then we also had institutionalized total quality management. All district leaders, the chairman of the district, the CAO, the health management team, and so on, they were all trained in total quality management. That is getting the results. What you say, I'm going to do this, how do I know that I'm doing it? How do I know? So one of the biggest problems we have is just that what we want to do, we don't do it. Talk, write, but, you know, things don't happen. Let's see how we are going to do that. The first thing in moving forward is mindset change. Mindset change. Let's start mindset change with you people. Mindset change which says that there is a problem, I'm not going to live normally with this problem. It's one of Africa's biggest challenges. People living normally with a problem. You go to a health facility, you don't find health workers, you don't find drugs, you say, what to do? You go and find a solution somewhere else. And those structures are there. Health unit management committees are there. Why don't you make noise and say, why is this not happening? This is supposed to happen, why is it not happening? We need to hold ourselves and our duty bearers to account. Not give up and say, what can I do? I'm poor, I'm nobody. You are not nobody. You are a citizen. You are not nobody. You are paying taxes. You are not nobody. You have a right to be served by those people who are there saying that they have been given authority to serve you. The chairman of the district says, elect me, I will give you this. The MP, elect me, I will give you this. Then all those people who are appointed, RDC, the CAO, the sub-county man, and so on, they are all your servants or community servants. Let's hold them accountable. Let them do their job. If they have problems, they should also refer them upwards. So that is, I think, the biggest problem that we have. Something is wrong, say, what to do? And you watch it. You are there. And you are not raising your hand and saying, but there is a problem. And yet these fora are there, these structures are there. Participatory development, the village planning committee, parish planning committee, sub-county, this, all this, they are there. Why are we not using them? So all these things we want to do will depend on whether we start with that mindset change. And it's also the reason why we are here. That's why we are having this summit. And congratulations for convening the summit. You are saying we want to do something about this. And then that implementation gap, which I've been telling you, things are supposed to happen like this, but they are not happening the way they are supposed to be, and we are doing nothing. We also need to have evidence. Everything you argue for, it's better if you have data and evidence. This is the reason why I am taking the line that I am taking. And think about developing data systems, collecting information. Then let's promote interministerial work. I've told you about from health traditionally, but I would like to see the youth ministry also being funded fully and being fully active. Community development officers, they are there. What are they doing? And they should be working with the health people, agricultural extension workers, and so on, because the needs of those youth in the rural area there. And then the education system. I told you what it was in my time. You would not leave primary one if you can't read and write. You can't leave primary one. So, let's get things to happen. But it will take leadership. Leadership from all of us. And leadership by us. Not waiting for someone else to start. And also grumbling. Stop grumbling. Start to do something constructive. Be as positive as you can. If we do this as a nation, and not wait to be led by politicians only. All of you are leaders. Something is wrong, please fold your sleeves and get to do it. And if we do this one by one and collectively, then you people, the youth, will have an opportunity to get those aspirations which you would like from the local governments. So, really, I have many things to share with you, but really, my real point, my key point is that the structures are there. They are very good, much better than in other countries. But in those countries, some of the things which we plan here, they are implementing, we are not implementing. So you go and develop a program of how to engage with local governments to ensure that all those structures which are there are actually active and addressing the needs of the youth. There are big questions about skills. They need money. All those things, the big problems, but you start by talking about them and looking for solutions. And the solutions also are there where those people are. You ask them, so what do we do now? And they will tell you what we should do. And what we should do, from what they say, would probably be the correct thing to take forward. And then the solution should be implemented with them also. Don't just go and order them around. It is not sustainable that way. So from us, the African Center for Global Health, ACHEST, we've started doing some of these things in some of the villages. And we are learning. And the biggest lesson, which so far I have learned, is that one, that all the structures are there. The second one is mindset. these appointed government people want money to do things which they are already paid for. So how is that going to change? Who is going to change that? It's going to be us. It's going to be us, you people, raising the awareness that why is this not happening in this village when it's supposed to be happening? And slowly using data and also being constructive, the right approaches. Mobilize yourselves. You are so many, so many. If you get yourself organized with a branch, not in every district, but I think in every sub-county, then we will start to see something happening. And every sub-county, a long time ago, a man called Nekion, he was the Minister of Community Development. He built community centers in every sub-county. I still see some of those buildings around. What are they being used for? You lead that, your group. And all these issues of, I'm not talked about teenage pregnancies and so on, but they are just a consequence of failure of what I'm asking us to put right. So let's address the root causes and we will get solutions to all this. So thank you for inviting me, and I hope that your forum will bear fruit, and that when you meet again next year, you will be able to celebrate at least early gains. It's going to take a long time. It's going to take years, a cultural change, a mindset change. And I wish you fruitful deliberations. Thank you.
Thank you very much, Professor. I could listen to the professor the whole day. You know, someone once told me that when you want to know how to go forward, go to the feet of the people who have been there and have done that. So, Professor, thank you for your time, and thank you for joining us. What was key for me was when Professor said he had 11, they were 11 pupils in class. When I went to school, we were 318 in primary, in my class. So I can only imagine, and I'm not below 24. So I can only imagine how many people there are in class today. So I think we can see how big the challenge that Professor is speaking about is. He was very deliberate about talking about mindset change. He also spoke to us about evidence. What I want to add to that is that this evidence will not come to you. You have to look for this evidence. So let us look for evidence as young people, and let us work with the structures. Let us pay attention to what is going on. He said that we have to be the ones. He kept on saying it has to be us. And he is not even below 24. So I am not below 24, but it is us. And when we say us, it means everyone has a role to play. We are going to listen to Norman Aweno, who is an M&E manager and expert. He is going to speak to us about the CSOs implementing RMNCAH interventions, and he's going to speak from a COVID context. Once again, please, if you are back home or in Lubowa, continue to tweet, continue to share what you are learning online, as we are enjoying the conversations there, and also we will be calling upon your tweets and conversations to involve you as well. Thank you very much. Let us listen to Norman Aweno.
Thank you very much, Flavia. And for Professor, for the time that you've taken here to clearly speak from an evidence point of view. And you reiterated quite a number of aspects there that I'm sure that the rights holders and the duty bearers can pick on. I am here to share with us a survey that was sanctioned by the RMNCAH Secretariat, and the survey in particular was focusing on SRH services, especially in the COVID times, and in particular, we shall look at the youth-led CSOs, but also CSOs that are serving the youth when it comes to reproductive, maternal and neonatal child and adolescent health services in Uganda. The survey in particular focuses on compiling partners' contributions. We look at the contributions of the partners towards the commitments that were made during last year's RMNCAH Summit. But also we look at the challenges experienced by these particular CSOs in providing SRH information and services, especially in the context of COVID. Let us not remember that. But also we look at the challenges experienced by the structures, and these ones in particular, the district committees on adolescent health in Uganda. I hope I'm not moving too fast, please. I want to take us to a small trend, just to tease our minds when it comes to maternal healthcare in Uganda. If we can look at the graph, it shows us of a significant reduction, especially when it comes to maternal death. We right from 2001 up to 2016, and maybe this can be attributed to the so many interventions, but also the structures that even Professor has been speaking about. We see a significant reduction from 505 deaths for 100,000 live births up to 336. But also we see a significant, when it comes to the ANC provided by the skilled providers, as well as when it comes to birth by a skilled provider. We have made gains as a nation considerably, and I'm sure this can be attributed to the so many strategies, but also the inputs by so many service providers and partners in the NGO world as well. There's another graph I want to take you to that focuses on the trends in the newborn, but also infant and mortality in Uganda in particular. We are able to see a steady reduction in child mortality rates, still between 2001 and 2016. We hit a bit of a stagnation when it came to 2011 and 2016, and I'm sure that such gaps can be addressed to hit the target which we had of 20 actually. When it comes to adolescent health, many has been said about our country. We have the youngest population in the world, and I wanted to tease our minds when it comes to some of the adolescent health indicators. Some of the interesting things we found in the studies, we have a population over 50% under the age of 15. But also, that tells us of what kind of population we are and what kind of interventions that have to be put in place to address such a young population. And I'm glad that so many of the partners have taken up some of these initiatives to, in particular, address aspects when it comes to the young people. If those are not addressed, then we are in trouble, just like Professor said. I want to move away and take us to the findings of the study, as time is not on our side. And we had 3 objectives inside there. And I want to focus on objective 1 that looks at the contribution of CSOs, especially in regard to the commitments that were made during last year's summit. From our survey, we found that over 95% of the CSOs did report that they made gains when it came to innovation. Innovation is the way to go. And we found that a lot of strategies were brought on board, including telemedicine, e-health. We found that some partners had actually entered into agreements with a Safe Border, using the Safe Border platform to provide services to the communities. But also, organizations entered into other platforms like Facebook, but also WhatsApp, using that, as well as Instagram, using that to sensitize young people. And this was quite an interesting aspect in them meeting their various targets. We saw that one of the organizations used an approach, especially at the height of COVID in the country, the snowball approach, where they would use fellow adolescents and fellow youth to identify others who are in need of services. And such approaches made significant gains. In the islands, some of the partners looked at opportunities using caravans to reach out to a lot of young people. And the caravans in particular provided information. Information is very, very vital, lest our people perish because they lack it. I want to take us into the peer-to-peer approach. We found that organizations entered into this approach using the youth corners. The youth corners are spaces that the youth found comfortable to share with one another. And we cannot deny them of such opportunities. Young people need other young people so that they can be able to open up to one another. But also we looked at them using innovations into peer-to-peer, having peer-to-peer dialogues, young people taking over dialogues and sharing relevant information. And they also looked at learning visits, where they would have young people from one area reach out to young people from another area. Inclusion is another area that was looked into. And inclusion organizations looked at especially leaving no one behind, especially when it came to the aspect of mental health. Mental health is an area that has been left out, yet it is steadily biting our communities. And I believe since we have Dr. Diana from the Ministry of Health, I'm sure that the Ministry of Health can also take up the aspect of mental health, which is steadily eroding our society. But also we looked at, the organizations looked at integrating development in terms of entrepreneurship, looking at supporting youth with IGAs. They also came into aspects of drop-in centers where youth could easily access services from these drop-in centers without being castigated or labeled. But also when it came to inclusive program design, it's one of the aspects that was factored in when it comes to proposal development as well as designing projects. Objective 2 mainly looks at the challenges that were experienced by most of these partners. And at the height of this was the transport challenges. And this was expected, as at the height of COVID, the country was almost at a total lockdown. Movement was a problem, and services reaching the communities was quite strained. But also one thing that came in there was the collapse of some of the groups that were established, which took us back to a place of sustainability, because some of the groups that were established have been found to collapse when some of the organizations resumed work with them as well. Notably to take is, of course, the aspect of the donor shifts in priorities. A lot of donors, I was speaking during one of my interviews, I spoke to one CSO person, and they said that lost 3 projects in a period of 1 month. And of course, that translated into staff losing jobs as well. So those are some of the challenges that were met during that time. Some of the innovations that were put in place that I spoke about in a graphical presentation right there. But most of the organizations focused at using the home-to-home approach. And the home-to-home approach, I believe, can be strengthened the more when we look at the structures that Professor has been actually talking about, because this is the easiest way of reaching particular households, especially when we are faced with times as such. Of course, technology cannot be left behind. With so much technology, I believe we can achieve quite a lot, especially when it comes to fostering telemedicine as well. I want to take us to, those are some of the voices that the partners have applied using WhatsApp for storytelling. And one of the CSOs told me that they would use WhatsApp platforms, Zoom platforms. Of course, the issue inside there was the affordability of internet, which was quite a challenge. And I hope some of these aspects can be taken up by the policymakers. I spoke about the snowball approach, as well as the Safe Border Initiative to extend family planning commodities right there. I must say that Jumia was also brought on board, which was an interesting aspect to look into, not just to deliver food, but also to deliver health services. Sustainability is one thing we cannot run away from, and sustainability is one of the aspects that was fostered by the CSOs. They talk about utilization of partnerships, but also looking at consortiums for resource mobilization. More money tends to come to bigger platforms, but also looking at the private sector for local resource mobilization. COVID showed us a very big aspect that there's a lot of money when it comes to the private sector. Because of time, I just want to run to the DICAs, the structures at the districts that are responsible for adolescent health. Those are some of their roles right there. Of course, coordinating services, as well as advocacy. Advocacy is a huge role that I believe they can be supported greatly to do, especially when it comes to advocating for young people, as well as monitoring work plans. Some of the challenges met by the DICAs are right there. Some of them are cross-cutting, of course, finances, meager resources, and of course, some of them talked about partners bypassing them, which I believe can be addressed greatly for effectiveness. Lastly, I want to focus on the recommendations that we came up with, and we thought that those are some of the recommendations for the DICAs especially. One that caught my mind was utilization of community platforms like barazas, not for politics, but for extending health services, information especially. But also the recommendations for government. We believe that the government can embrace the inclusive approach, which I believe has already taken root, so that no one is left behind in all the populations in our country. But also emphasizing the intersectoral aspect of delivering information, but also services among the line ministries. And lastly, or second last, to the donor community. We believe that the donor community should look at supporting NGOs, beyond even just COVID, but looking at a more integrated aspect right inside there, but also to reconsider always when we are into emergency cases as this, that opportunities and priorities of donors should not just shift without considering the organization. And lastly, to the civil society, emphasis on partnerships. Partnerships are the way to go if we are going to be able to move as a unit, but also looking at local resources. There's a whole lot of money in the local communities or in the private sector. And lastly is one of the voice extracts, of course, one from the professor, and he says, Professor Maswa, he talks about creating opportunities for the youth to take charge of their own lives. And he says Africa's biggest challenge, their own lives, is Africa's biggest challenge. And it says that, he goes ahead to say that let us all rally behind the youth and also listen to them in particular. But also a few words from Winnie Musibika, who is the director at Teenage Naguru Center. She says that RMNCAH is more important than ever. Policymakers need to understand that young people have a voice and not just to disregard young people. COVID-19 has also presented us with an opportunity of how to reprogram and to address especially emergencies and so on and so forth, as it is showed right there. But also, importantly, it's the role of CSOs and government to give young people platforms such as even the RMNCAH Summit for young people to express themselves. Thank you very much.
Thank you so much. And I want to thank all those participating online. The team in Luowa, we understand that the different hubs and the ones in northern Uganda, thank you so much. Let's keep the treats coming through. But without going any further, ladies and gentlemen, allow me, together with you who are here with us, to welcome the PS of the Ministry of Health, Dr. Diana Twine, for joining us. A round of applause, ladies and gentlemen. And as a journalist, I don't have the clout or the powers to invite you to give us a word or two. Allow me welcome Professor Omaswa Francis again to welcome the PS to address us this afternoon.
Good morning once again, and it is an honor and a pleasure for me to be asked to invite Dr. Diana Twine, the Permanent Secretary in the Ministry of Health, to address this important gathering. I really want to appreciate Dr. Twine for taking off her Saturday morning to come here. Just shows how seriously she takes your work. And I'm also very happy that the Office of the Permanent Secretary in the Ministry of Health is going to interact with you, and hopefully at the level of permanent secretaries, she will get her colleagues from the youth, the gender, and other ministries to address the issues of these people. I've spoken already. I think probably you were not here when I spoke. What I told them is that in Uganda, our structures are there, which leave no one behind all the way to the household. It's just a matter of getting them to happen. That is our challenge. So, Dr. Atwine, you are welcome to address and I think officially open the forum.
Professor Maswa, our esteemed guests this afternoon, the organizers of RMNCAH Summit, I want to thank you so much for creating this opportunity to bring us together for this summit, and also for those that are online. I apologize, I came in late. I was supposed to be here earlier, but we had some issues to do with the returnees and those that are coming and were unprepared for. So we had to find ways of accommodating them, and it kind of, I can even see Dr. Mugahi is not here. So there are a number of issues we were trying to sort before I came. But first of all, I want to thank you. I want to thank the organizers of this summit. Adolescent health, specifically. Of course, we have had opportunity to talk about maternal and newborn. But what I do believe that today would be the gist of our discussion is how to strengthen adolescent health in emergence with all these emerging health challenges, including COVID. But also, how do we engage the key stakeholders to think alike? Because what has been happening in our country is that we have all these ideas floating around. We have all these interventions that are taking place in different areas, in different spheres. For example, you have civil society organizations doing a lot of work in adolescent health. You have government doing a lot of work in adolescent health. You have religious, and I'm glad to see some of the religious leaders here doing a lot. How I wish that one day we will have one program, same activities, same implementation strategy, same voice, and same evaluation. Because when we do that, we will have more synergy. And for me, when I came here, what excited me is that we have media, we have the youth, we have civil society, we have religious leaders. That means that if we create this synergy, we will accelerate our interventions that will definitely take us far. As you saw, really our population and our e-health indices are there before us, and the presenters, I believe they ably took us through the statistics, which I will not go through today. We still have a big challenge of teenage pregnancy. Yesterday, we were having a meeting in the ministry to discuss how we are going to deal with teenage pregnancy amidst COVID challenges, because most of our children who are not at school, because school has been playing a big role to keep our children at school, keeping busy. The young people are very active people. They have a lot of energy. When they are at school, they are very busy. They are kept busy. And before we realize, the time passes and they get engaged. When they are at home, and especially in urban, where they are not doing anything, you find at home, you have house help, and they wake up and have tea and sit there, watch TV, and then what they decide, they go out to the mall to walk around. And then throughout that, our young people get more threats now. There are more threats now facing the young people more than before because of the barriers right now that we are facing as far as COVID is concerned. And no wonder now we are seeing many of the children, many of young adolescents have had challenges of pregnancy. Yesterday we were looking at the statistics of Kawempe Hospital alone. We are seeing more young ladies, young girls, very young, 14, 15, coming with obstructed labor. We must stand together. We must speak with one voice. We must think together. The implementation plan that will reverse this, because this will be like a vicious cycle. Young girls drop out of school, they get pregnant, they get obstructed, they get complication at birth. Either they lose their lives or they don't lose their lives. They get fistula because of obstruction, and the cycle continues. And then they become independent or to other people, or their families, or their husband, whatever. That means then we'll have a bigger cohort of young people dropping out of school, and that has also an impact on our literacy rate. That also has an impact on productivity of our country, because the youth is the most productive and energetic group. And so we cannot afford we need to capture this opportunity. And as we gather today, as we discuss how we can enhance improved service delivery, we need to look at, first of all, and I'm glad we talked about the community, and Professor, that issue of starting with family unity, so that the responsibility begins at the family unit, the household. If we address issues at the household level, regardless of whether it is urban or semi-urban or rural, if we are able to address these challenges of adolescent health at household level, that means we need to have a very strong family outreach. If I have a child and I cannot manage, I'm here, I have teenagers in my house. And you have to all the time you are stopping them from you're stopping them. But if we do not have the strong family values, let me say, first of all, at the household level, then it will spill over to the community. Then what do we do when it is at the community? We have very strong community interventions. If it spills over to the community and we have strong community interventions, we will be able to deal with those challenges at the community levels. We are at the edge of modernization, where we have co-opted, before they would say, it takes a village to raise a child. But now I will not find any child engaged in some weird things and I say anything. Even if I know that son is so-and-so's son or so-and-so's daughter. I cannot do anything. If we only have strong community interventions, if all these youth that are now they are out of school, they wake up in the morning, they meet in the rural, they have what they call vivanda. And they all there gather there. Then they have peer influence. They have their kind of interaction. How can we maximize that interaction to influence for better outcome? The civil society, in this case, plays a very, very important role. The church has a very important role to play. The government structures, right from LC1 and the VHTs and the community development officers and all those, we need to get to a level where we'll get to one room like this. Or now we can't get in the room because of COVID. But at least we have a platform where we exchange ideas on how to strengthen our reproductive health, especially in adolescent health. You have talked about psychosocial. I was looking at these young people who have been setting themselves on the fire. They are not old people, by the way. They are young. They're young people. They are not very young, but you can see that they are in the age of 20s. How do we maximize the energy? How do we support the young age that is mass productive? We maximize that energy to increase productivity, to increase sustainability, to build interventions that are sustainable but can keep our young people engaged so that they are shielded. They are shielded from all these issues. When you go to Butabika now, they have even expanded another ward on drugs. Young people on drugs. And because they are on drugs, they cannot control themselves. They end up being in another area altogether that if it is a girl, they end up getting pregnant. If they are a boy, they'll be influenced to take drugs, to be involved in all sorts of things. And then they get even exposed to other health issues. So for me, I'm sorry, I'm focusing on adolescents today. The maternal, we have had the sessions. The newborn, we have had some sessions. But adolescent health at this time, when Ugandan biggest population is in this age bracket, we need to tap the energy. So for us as Minister of Health, and really I came here to affirm our commitment. I came here to affirm that Ministry of Health has put in place the strategies, has put in place the policies to deal with adolescent health issues. But we can't work alone. That's why it's very important that civil society, other government agencies, the community, the population, and adolescents yourselves, your voice, to start thinking, what can we do? How can we do it to safeguard our future? What can we do to be more productive? We want to hear those voices. We want to hear those voices from adolescents to say, this is what we want to do, this is what we want to be, and therefore we want you to support us. We are even available to offer psychosocial support. Because at this time, even challenges have increased. They are more than even what we were dealing with before COVID. And therefore, Ministry of Health is very willing and committed to support you. I want to support you. I want to thank the organizers. I want to thank specifically the team that has been behind organizing this meeting. It would even have been more exciting to have more numbers in one room so that we discuss and we have brainstorming sessions, but it's not possible. But still we can use what we have to reach out as many and to get their voices still heard. We want to commit that we shall support the youth, we shall continue to support the youth, the adolescent, in all ways. When it's education, when it's psychosocial support, when it is productivity, we are willing to support. And recently, this program started in Kampala is very good. I have had people confess, really, that the youth, they were trained the what do you call this handcraft and yes, skills training that has kept them so busy that they would hardly. There are people who would say that even they had taken like 6 months without going downtown because they are very busy. Training in this, and when they get those skills, and they are able to sit down and get support from government, and they are able to be productive, then they will not be taken advantage of. Then they will not find themselves in a vulnerable situation where they have to be cornered and they get in practices that put their lives at risk. Thank you so much, and God bless you.
Ladies and gentlemen, again, I request that a round of applause to our peers. As a nation, we are such challenging times, and I want to commend the peers, together with the Minister of Health and the leadership of our country, that you have helped us sail through COVID-19. COVID is real, and we are hoping we sail through safe and sound. Key takeaways from her address: she said that standing together with one voice possibly is the best and the only solution we have. At all levels, we need to pull to the center if we're going to address these issues. And this conversation is at the different hubs in Central. It's at the Lubowa Action for Health, and it has sponsored this entire Central hub, and I understand you're watching us from that side, and thank you so much for your feedback. And in Eastern Uganda, East happens to stand out as per last summit's commitments. East happens to be one of the regions that has registered a lot of teenage pregnancies. Madam PS, I happened to travel to Iganga 5 months ago, and I met a 13-year-old girl who was gang raped, and they had stuck an orange in her privates. And the more I followed up the story, I realized that 17 of her peers in the village were raped equal, and it was more like a norm. But until when we have these conversations, that's when we can start to change these stories. So I want to thank those who are already here, and to make this much more better, the conversation about this, we have honorables who have joined us from the eastern part of the country.
Yes, and it is interesting that they are all from the eastern part of the country.
That's the
so
beauty.
we have Honorable Bagole John from Luka. Honorable, we welcome you. We have Honorable Nawat Rosemary from Amdat. We have Honorable Mokisa Hope Robina from Namayingo.
Thank you for coming.
Then we have Honorable Nabulindo Jen from Busia.
Wow.
As you said, conversations like this, it is very interesting and very important that everyone is in the room, so we welcome you very much.
Thank you so much for coming, and it means a lot. And those watching us on the different live streams, we are live on NTV, but because of the business approach, we'll be off NTV at exactly 1, but we still stream live on the other radio stations in the east, in the north, and some in the central, but as well on the digital platforms. On Twitter, we have our Zoom link where you can join this conversation. Now, to make it much more better, we're going to have our panel. Kemi, if you could invite the panelists and we get this started.
Yes, we are going to invite Faith Mariah from SRH Alliance, who is going to be representing the young people. We will invite Dr. Richard Mugahi, who is also our patron and our big brother of RMNCAH. We thank you so much for your commitment, and we invite you to the panel. We are going to also invite Miss Friday Madina from the Ministry of Labor.
And lastly, we're going to have the Right Reverend Archimandrite Constantine Mbonavinji from the Orthodox Church. He comes with a wealth of experience when it comes to youth, teenage with regards to religion and how best the two can plug to play a key role in changing behavior and making sure that we achieve as a nation. We're so gratified to have you here, and we're going to have this conversation. We're going to have a little more answers. I'm so honored to have a religious leader a part of this. And with the weight he holds, he's more like an archbishop from the Orthodox Church, but he's such a champion to this. To start with, let's start with the Alliance, rather the SRH, with regards to trickling down the program for the youth at the grassroots level, because we start from family unit level, we go to the village level, we go to the parish, the sub-county, then we go to the district level. Kemi, if you can.
Okay, so, Faith, what are your thoughts on today's theme? Recognizing that young people are the most affected on SRH issues, and later, the effects of COVID. What are your thoughts?
Thank you so much, Kevingisha. First of all, I want to appreciate the previous conversations that have happened, and they really speak to the reality that is on ground. I do not sit here as Faith Myra, the youth country coordinator, but I represent the young people that are in the city, that are in the urban centers, but also young people in the community that do not have the ability to be on this platform to speak for themselves. So today is a very interesting topic because we're looking at the real deal, like young people say. So we're looking at the real deal of the structures in the community. For example, Professor Maswa has already said a lot about it, but just to dive into, the first question I asked myself when I looked at this theme was, how many young people know that there is a district committee on adolescent health, that there is a health unit management committee? How many of them in the community know? The answer to that, I basically know, we that have just dived into this topic to understand or probably have a lot of interest are the ones that know. So that leaves so many young people unaware of these structures. But that is not the worst of all. The worst of all is there's no representation of young people on most of these structures. I just have to also appreciate the Ministry of Health that so far we have 18 functional DICAs in different districts. But my question would be, how many young people are represented on these DICAs? And if we're speaking about young people, who know best their issues, who articulate them properly? If they're not well represented, it leaves a very big gap that we are just having this conversation here. So I just want to, for example, when you speak about the parish planning committees, these are committees that are the lowest in the community, but you'll find the people that are there, not to be offensive, but exactly they're going to be about 50, the LC ones, particularly in that age. And what are they talking about? Probably their sustainability for their old age. So I just want to bring this conversation to the reality of a community in Mayuge district, Pungwe sub-county, if I'm to say that. The LC one is probably 70 years, and then these committees are sat on by adults. And these young people are getting pregnant every day. They're having issues, STIs, that they are afraid to go to health facilities. To make it worse, the youth corners were functional before COVID, but right now with the guidelines of social distancing and making sure there's no crowd, even young people are afraid to go to the health facilities to access these services. Even when they go there, they stock out of condoms, they stock out of painkillers, and it's a whole package of problems that young people are facing. So to me, this is a very interesting discussion that I want us to go ahead and just look into how does the DICA prioritize and influence local solution in terms of the issues that are actually affecting young people. And if it is in terms of advocacy for resources, what are they doing as DICAs to ensure that those voices of young people are part of the advocacy platforms? Because this is something that we want to appreciate, that yes, Uganda is highly young, and we can't avoid that fact. So we need to appreciate that now. We need to bring these young people. And I often say, you might say that young people will not be able to speak. So bring me in a platform, capacitate me to be able to represent you, to represent the young people. So I think we need to move forward from having this discussion in this hotel and go to the DICA in the community, find out, is there a young person? If they are there, are they able to articulate the issues affecting them? And if yes, are they representing all the different diversities of young people. When we start moving forward with such actions, we'll actually be moving, as Professor says, that we need to just start doing and move forward. Yeah. So in terms of opportunities, exactly, if we're looking at, you see, every challenge presents an opportunity. And I think to all young people out there, this is my call to them. I mean, this is an opportunity for us as young people to stop whining about this and just move forward and go to this district to ask, where is the committee? When do they have meetings? We need to be engaged. Are they discussing our issues anyway? I was actually speaking about the COVID-19 task force at the district. If you just scan around, look at the people that are represented there, I can assure you that to find a young person below 24 years on that task force would be a miracle in this country. So, and these are the things, these are the people most affected there at home. I was having a discussion with some of the students just yesterday about one, and I was asking, one was in primary 7, so I was asking her, so what do you think of school? She told me, I gave up on school, I can't read anymore. So these conversations, and they are frustrated mentally, and there's no such psychosocial support to encourage them, because someone is like, am I going to repeat class? I mean, they had planned it earlier for education.
Okay.
So what is the government doing at the district level, at the community level, to ensure that these young people are supported to still have the courage and motivation to look forward to school? So I just want my fellow panelists to deliberate on that as we go forward, because it's a very candid issue that we need to discuss about.
Thank you so much, Faith. I can feel the passion when you talk about inclusion of the youth to get involved at every level. Well, I'll go to Friday Medina from the Minister of Labour and Social Development. What are the avenues for collaborating with the Minister of Health and the communities to deliver the sexual reproductive health programs to young people at community level through what Professor dubbed as structures or systems?
Okay, thank you so much.
Sorry.
Okay. Thank you so much. I greet the young people in attendance, both here physically and those online, because this is a very good intervention with the discussions that affect the lives of the young people that we are all concerned about. And before I get to exactly where you want me to point at,
Because of time, and we're live on TV, so that's where my challenge is.
don't worry, I'll be on
Thank
time.
you.
Just that to inform the young people in this house that the celebrations of the International Youth Day are on, and this is one of the pre-events that we are having, and many more coming up to the D-Day. The Minister of Gender, Labour and Social Development obviously is responsible for the issues of the young people, and we have the mandate to organize and collaborate with all the stakeholders to ensure that the issues of the young people are taken care of. And to go straight to the existing structures, we work closely with the district local government, where we have the Department of Community Development Services, and therein we have probation officers and community development officers who directly handle the issues of the young people. And we have gone ahead to rationalize or operationalize them working with the parasocial workers at village level to ensure that the young people are sought out in the communities where they live. And at the Ministry of Gender, we have also we have a strategy for family. We have the family. It is called parenting guidelines, actually. We have parenting guidelines that help us to work directly with the families, for them to empower them to talk to the young people and to give them age-appropriate information. So for this, the Ministry of Health, where the collaboration is, We have had so many programs that touch the young people, but directly in the Ministry of Health. So we recommend them always to work with the community development officers, because that is where the through the community development offices, the young people are reached. And these parasocial workers that we have trained at the Ministry of Gender, they know how to reach to the young people from their families.
Now, you see, Madam Madina, that's where it gets complex, because Faith says when you go to the communities, the people who are meeting the youth are not age-friendly. They're judgmental. You can't walk to someone who is 50 years of age and you're telling someone that, look, I got pregnant because I was reckless. The comfort, the friendliness, you find someone who is 50 years of age, even the choice of words they use when you go to them, they start to castigate you. Why? Because
and just to add, the 50-year-old is also your mother's choir leader in church.
You get it. So the issue of religion, this is someone you pray with in church, and this is someone you have to go to and open about what predicament has befallen you. So that's where we go. Are those people you're talking about, the para team at the village level, are they within the age bracket that is friendly to the youth?
Okay, that is the challenge generally that is on ground. But in our intervention, we really do encourage young people engagement and involvement. And that's why we are working with the Commonwealth to develop the youth participation guide to be disseminated to all partners we work with. But specifically with the Ministry of Health, I must say we have supported them to come up with some peer-to-peer programs, because we noticed that the young people's issues related to sexual reproductive health can only sorted when we use the peer-to-peer approach. For instance, I can give an example of the program they have, the young people and adolescents peer support, supporting young people living with HIV. We have been at the forefront of that, and we have guided them on how to engage the young people. And this program is practically run by the young people living with HIV and supporting the others. So we still have more to do. Some people have not understood the importance of working with the young people to deliver their own work. And this is where our next step is.
Thank you so much.
Yes. Thank you very much, Friday. We are going to find out from Dr. Mugahi. How can, you're going to just speak to us about establishing and sustaining district structures. When you weren't here yet, but Professor told us that the structures are there. He assured us that the structures are there. We are hearing that young people are not on these structures, but he also called upon us to go, to make the effort to go there. So we just want to hear from you. How can the Ministry of Health ensure operationalization and sustainability of the DICAs across the districts?
Thank you so much, moderator. My sincere apologies for coming in late, but I've been tracking you online. I think I'm very well qualified to speak about the district systems where I've worked for the last 18 years, and 8 of those were as the head of the district health systems. I entirely agree with Professor that the structures are in place. We need to walk the talk. And I think a forum like this one is a welcome opportunity for us to put our heads together and think through clearly on how we can work with the existing structures at the subnational level to ensure that service delivery reaches the final beneficiaries. There's been a natural tendency of more of a jungle law or survival for the fittest, and it seems the young people have been left out because of a lack of an advocacy platform. There are, of course, many priorities at district level, and the formation of DICAs, which I've been part of, I think is a very welcome opportunity to galvanize the voices of all the key stakeholders at district level, to pull together and focus on issues of young people, specifically sexual and reproductive health. So, to be very direct, the structure of a DICA, which is well described in the adolescent health policy, still in draft form, is one thing that's really going to ensure there is proper implementation of adolescent health interventions, there is proper accountability of adolescent health resources, and also appropriation of the little resources, whatever is at district level, to ensure that there is implementation of adolescent health interventions. If we had come from where we came from last year, the formation of 18 DICAs, or district adolescent health structures, is a huge milestone in my thinking. But also the Ministry of Health has moved another mile of mapping out the high burden districts. We know districts are breaking quite often, but we currently have an inventory of precisely where our burden is, where is our highest burden. And we came up with 40 high burden districts supported by evidence, and we are currently implementing interventions, also setting up DICAs in these high priority districts. This doesn't mean that the rest of the 90 plus districts will also be left out, but we're also working around mobilizing other stakeholders, mobilizing other partners to ensure that we come to cover the entire country, because as we improve these high burden, the burden shifts to the other districts. So the structures are in place. We seem to be having the support. You've just heard from my permanent secretary. We have the stakeholders here. We have the legislators in the House. So what is the missing link? I think the missing link is actually what we are doing, trying to pull together, contributing every effort you have and walking the talk. We should stop it, not stop it here, but move down. Like you did last year, you said we are going to make structures, we made them. And now keeping them alive is also another success. Thank you so much.
Thank you very much, Dr. Richard. Just for the young person who's listening in and you're watching, Dr. Richard, if I'm a young person in Rukunjiri and I want to join in on the conversations at the district, what steps can I take, like at that level?
Yeah, actually, apparently, the discussion, when you look at the DICA, which is our focus, I think, majorly today, there is a representation from education. Our imagination is we cannot have a forum where every young person would be seated and listening in. But we want to see an environment where issues of young people, whether at school or out of school in the community, those in school are being represented at the DICA by the education department, and issues are being captured through the school system. And what is very special here is we have at Ministry of Health level, we've emphasized training of the senior women and the senior men in schools. We have a number of health interventions that go up to school level. Immunization is one of them, growth monitoring. We also do deworming. So all these school health programs are going to be channeled through education. My colleague and friend from gender did mention that on the same DICA, there's someone from community. So gender will represent a section of the young people out of school. We have a couple of those ones. So the young people out of school at district level, they have a CDO, they have a parish. So they have community participation groups. We want to form some bit of peers. And me and the team, we are also in advanced stages of pushing for representation at the health unit management committee. I have interfaced with the commissioners who are in charge of this, and we are following up with Joshua and Group. We hope that if there can be representation at the health facility level, health facilities at sub-county level, parish level. We think issues of young people at community will also have another milestone because that is closer to them, really, really close. And if there's a problem with the facility, the issue will be represented in the health unit, which is the decision-making organ. Health unit management committees actually own the health facilities. Thank you.
Thank you very much. For the young person out there, what this means is these issues will not be discussed if you do not speak. So you have to speak to your leaders. You have to engage them. You have to make sure your issues are heard. If it's online, if it's walking to the district office, you have to let your issues be heard.
Well, thank you so much, Doctor. And going now in the religious lane, the Right Reverend Archimandrite Constantine Mbonabinji from the Orthodox Church. In the wake of COVID-19, children have been home purposely because of the pandemic. It has been long overdue. They're not going back to school either. Over time, we have received figures that are appalling, figures that they are scary to me as a parent. But as a community, I'm equally worried with regards to resources. I want to know, what is the role of the religious leaders with regards to promoting and playing a key role in promoting the SRH of the young people in Uganda?
Thank you very much. Yeah, I'm called the Reverend Archimandrite Constantine Mbonabinji, and I'm here in many capacities.
Yes.
First of all, as an Executive Secretary of Uganda Joint Christian Council. I represent also the Faith for Family Health. I represent the Riyadh Rwenzori, a religious leaders initiative for development, and also the Dean of the Orthodox Church. First of all, when I got this invitation, I was extremely very happy because I wanted to convey certain message to our religious leaders outside there. A few days ago, at my office in Zambia, people from Save the Children came to me and said, Father, do you know what's happening in some districts? Hundreds of children, teenage children, are getting pregnant. And so it cannot be business as usual. Reverends have children, and children are under lockdown. The reverend will not be happy to see her teenage, a 14-year child, having been pregnant by a 16-year child. You see what you see the trend from which I'm approaching you. We have had, as Faith for Family Health, issues concerning family planning, issues concerning adolescents. We have tried our best. And we have worked in many districts. We have developed district cost-led implementation plans. And really, people have committed millions of money to do what to help even the youth. Has the religious voice come out? That has been one of the problems. We have helped really. Now, some of you who listened to Archbishop of the Anglican Church during COVID, he said, please, men are going to have what? Strength. Men are going to do what? And that strength will be idle. And what will be the consequence? You know, the poor man is the TV, is his wife. And you know the result. Now, as religious leaders, we have structures. 75% of the schools, believe me or not, belong to us, are funded by religious leaders. And any information which we can give, which I can give as Father Constantine, which the archbishops can give, will reach directly to the what? To the last person. Hospitals. Hospitals, we have many. Church-funded hospitals. Even our Muslim brothers have hospitals. We are putting in these family planning services. We are putting in youth-friendly services, but using the religious approach. You know, the way I talk now as an Orthodox, the way I can talk as a Catholic is not the same way I can talk as an Anglican. Because of doctrines, we have doctrines, values, and whatever. But all of them aim at helping someone on the ground. Now, why have I said that this will not be business as usual? After COVID, or during, COVID has come and we have to live with it. And if we have to live with it, how are our children going to survive? So we are trying to say, for instance, UJCC, we are working hand in hand with FENU. FENU is Forum for Education of Non-Governmental Organizations in Uganda, to see what can we do as religious leaders, leaders of private schools, to make sure that these children whom they said are going to be safe at home, they are not safe. Can we look for a way out now? Can we can we bring the laity on board? Can we bring these other religious leaders on board so that we look for a solution? And we are doing it. Few days to come, you will find us again on NTV to give you our position. We are not sleeping. And you know, lastly, one white man asked me that, Father, why is it that you have very big walls around your houses, but for us in Norway, these things are not there? I would not answer. He said, you are thieves. You have cheated a lot of people. You have embezzled their money. You have left these youth out, unemployment being high, and you are trying to protect that money you stole. So one time the youth will come and get that money. And it is true. We are sitting on a time bomb. This summit has come at a right time. I wish you had developed senior religious, more senior than me.
We are going at level, Reverend, and I'm sure we'll get there.
Okay.
We'll get there. Thank you so much. The religious leaders who are watching us live on NTV and on the other platforms, like the Reverend, the Right Reverend has made it much more clear. While you're sending out the gospel, regardless of the dominion you subscribe to, involve and engage these conversations with regards to sexually healthy and reproductive health information. Let's involve them again and again. We have someone on Zoom in Ginger. Is Jameson from Ginger. He's already in the hub and is ready to join this conversation. James, if you can hear me, can we have him through? James?
Yes, I can hear you.
Okay, what do you make of the entire conversation with regards to this summit's approach this time around?
Well, as Eastern region, we have had a number of cases of early marriage and teenage pregnancies. And these kind of summits are the spaces where we as young people can come in and engage local leaders in a way that they would also help us out. With me here, we have young people from different partner organizations, and they are with me with a lot of recommendations that they feel would help out in curbing all the cases that we have been realizing. It's so sad to see that teenage pregnancy is still a thing that is affecting our young girls in the communities. Well, due to COVID-19, our work or our role as peer educators has been very hard, and giving young people information regarding sexual reproductive health and rights has not been possible. I have recommendations. Yeah, I do have recommendations that are straight to the local governance to see that they try to commit, to see that they commit and be accountable and also responsive to adolescent health programs. We do have those who commit.
James, I think technology is... Can you hear me, James?
Yeah, I'm hearing you.
Carry on, carry on.
We are having technical problems here,
No, it's
but
okay,
it's all settled now. So what I was trying to say is that we really need the help of the local governance in the Eastern region. We have those who are coming in, leaders who want young people who want to become leaders. But then in their campaigns, they don't point out the issues that young people are going through. They talk of youth livelihoods and how they want young people to develop economically. But then they don't realize that without good health or without good SRHR, without better SRHR for them, there is no way they're going to succeed in life, because I would be battling with the mentality that I still have to commit to addressing my health and live. I would have to put my life first before pursuing my dreams in life. So I call upon local government with much aggression to continue providing effective, communicated, and accountable leadership responsive to adolescent health programs. And also, District Committee on Adolescent Health needs to put in more efforts in advocating for adolescent health development at both district and national level. We also cry out to the DHO that they at least should train service providers and also retrain them in giving youth-friendly services. Young people, they have a lot of problems that they go through, and it's really hard for them to talk to those who are not of their own peers. And if they are to go to the hospitals if they are to go to the hospitals and not find their fellow young people, they would not feel very comfortable at all. They have fear of being judged. You know, the hospitals that are in the communities, sometimes it's for everyone. Like even those who are in your nearest neighborhoods, you would find them there. So you try as much as possible not to give in all the information because you think they will still come back at your homes and tell you that James did this and that, and and we have found out that he's suffering from this and that, which I will not be comfortable with.
Thank you, James. Because of time, James, allow me to let you go, but we're still with you. We resonate with you, and part of your requests are some of those that we're highlighting. You've heard what James is saying. Kemi, if you could engage Faith more about this, because it's more like he went on a sabbatic about what Faith was highlighting earlier.
Yes. So, Faith, talk to us about how the structures, how critical they are right now, and how critical, what is the role of a young person? How critical that role is with what we're talking about.
Thank you so much, Kemi. First of all, I want to say that the fact that we're speaking about young people, it is critical. And it cannot be more critical until you bring the young people on board. So I think COVID-19, I would love to put it plainly, that has undressed us. We've seen the gaps that we have. So we have an opportunity to dress up and just fill up these gaps to address. So one important thing is we realize there has been no inclusion in most cases. For example, we speak about the young people living with disabilities. The president issued out guidelines that there is lockdown on transport and there's no border, there's no taxi. And then there's this young person who has a physical disability and they want to access a service. So that shows how that wasn't put into account. And these are being enforced by the task force at the district where this young person is not represented to say that. So that shows how much it's critical. And you'll find these young people living with disabilities, we're having living risky lives, having very risky sexual behavior at that time because they couldn't access services. Another reason why it's critical right now, we realize that young people at home, previously before COVID, we would benchmark on the fact that young people at school and somehow civil society organizations meet them at school, the teachers are giving them information about their body changes, about their MENAC. So there was always an opportunity of tapping to a resource of information. But here we are, stuck at home with children that parents are shying away from this kind of conversation. So what that does mean, we need to bring young people on board to empower them with information, but also to be able to at least, you see, sometimes the relationship that we have between our parents and children is more of like, I need school fees, I need food, I need a dress for Christmas, I need this. That is the relationship. And when we go to having a conversation of, Mom, I am crushing on someone, I feel I like him. When I see him, I feel I'm feeling tense. There is no that conversation. Actually, you mentioned that you might get a slap of your life. So literally, if we do not have this relationship to discuss this conversation with our parents, and we cannot afford to meet our peers to discuss that could give us maybe some information or teacher, then what leaves me to that? To an ignorant decision. That makes it more critical to that. But most importantly, when you're speaking about statistics prove us all right, 50% below 15 years. These are young people that are just starting to grow. This is when I'm developing breasts. This is when I'm getting my menstruation. This is when, and you see, when you look at the DICA at the district or the HUMIC at the health facility, and you look at the people that are heading the HUMIC, like Dr. Mugahe said, these are the people that own the health facility. But when you get there, believe me, you will see a different story. So it needs us to move away from assuming for young people, speaking for them, finding out solutions for them, to bring them on the table, and not just with tokenism, because we have this thing of, oh, we have a young person represented. We need representation that is meaningful, in the sense that if I'm seated on this panel, I understand the topic, I understand what we're talking about and what impact it has on my fellow young people. Even if I could be more privileged, that I do not have that kind of, that I'm not that ignorant. So we need to represent young people meaningfully on this, and it comes at a very important time that now we're seeing these teenage pregnancies, there is suicide going on among young people, there is a lot of violence in homes, and this is all affecting young people. But again, young people are giving up on their dreams of school, because I'm sitting at home. I was a candidate in my senior 6, and I was just looking forward to join campus, and bam, you're not going. You're here. So I'm frustrated, I've grown, the other people are going to find me, maybe my sisters are coming in. That is all an issue. And it has a lot of mental thing around it. So I think for me it's very important, first of all, is because it's about young people. Let's not talk about young people, let's not talk about young people's issues without them. And from that, we will move forward to solutions that are actually friendly. Because you come up with a solution and say, okay, as Ministry of Health, we have decided that the district will do this and this. But when it goes to community, young people reject it. And we're good at rejecting those things if we're not involved. And however much it was planned, resources were put there, people will just get money or salary and do nothing. So we need to move forward and bring young people on board. That's why it's very critical right now.
Thank you, Faith.
Thank you so much, Faith. We're still joined, many hubs are still happening. I want to send out shouts out to the hubs in northern Uganda, and we have those ones in the central, we have the ones in the east. Kemi, what is happening at the central hub?
So at the central hub, we have them in Lubowa at Action for Health. Action for Health, thank you very much for supporting the central hub. Is Maureen ready to speak to us? Yes. Maureen, we are going to hear from Kamara Maureen from the Central Hub.
My name is Kamara Maureen, and I'm the chairperson of Kampala YEC, that is the Youth Empowerment Center, and I'm also a club member, Mission Youth Club, in Kisenyi, situated in Kisenyi. This year's summit comes at such a time when there's a lot of SRH issues that need to be addressed. There are a lot of issues that the young people are going through, and I feel with this lockdown, there is a lot that has been going on because most of the young people, those that are actually out of school and those that were in school are now in homes, and there is no, they're not working yet. These are the same people that were daily income earners.
I
Maureen?
hope they're safe and sound where
Yes.
they are.
I hope they're fine as well.
I had some blasts there. We hope they're safe and sound. Well, coming back to the Ministry of Gender and Social Development, Madina, what are some of the steps the ministry is taking on government's side to make sure that the youth in Uganda contribute in achieving the national and international commitments relating to the SRH and the development, that is with regards to the RMNA, the NDP2, rather 3, the ICPDA and all that? What is government making sure that these commitments are inclusive of the youth?
Thank you so much. First of all, I would like to note that with Faith is concerned, the government of Uganda and the Ministry of Gender supported the creation of the National Youth Council, and we have representatives from the national level, the district level, and stemming even from the community. And at the district, we still have youth councillors. And like Professor said, sometimes we fail to know where the problem is for representation. Because if they are forming, for instance, the COVID task force, why wouldn't a young person who is represented at the district represent the young people on that task force? So the challenge is for you and me, Faith. So to have all this in place, especially when I talk about sexual reproductive health, we have been working closely with the Ministry of Gender since the National Youth Policy was put in place to put or enhance youth-friendly services at health facilities. Some are existing, but there are some gaps, and we are supporting that process, especially to ensure that the practitioners there know how to handle the issues of youth. And then, more to that, at the ministry, we are supporting mainstreaming of youth issues into sector plans. So wherever we want the young people's issues to be taken care of, we send in representatives to enrich their programming and also their policies and guidelines so that the young people participate and also get engaged. And we have gone ahead to integrate, because of the Ministry of Gender dealing with youth out of school, we are more concerned about their livelihoods, how they get out of poverty, and we have a number of educational programs. And in these programs, we have integrated sexual reproductive health issues as major concerns to be tackled in the delivery of these programs. And as we looked at youth participation and inclusion, we realized that it is not a concept that has been accepted generally. When there is a meeting, like Faith says, one representative is enough, but how is this meaningful? How are the young people engaged, apart from just inviting one young person in a forum where it is full of old people? How do you make sure we harmonize the intergenerational collaboration? So we have come up with a youth participation guide, which we are completing, and this one we shall take it a step forward to make sure it is embraced. I thank you.
Well, thank you so much, Madina. Now, I understand Maureen Kamara is back. They're safe and sound. We thank God that they're back. Maureen, if you can hear me, you had a submission earlier.
Yes, Andrew.
Carry on.
You hear me?
Yes, I can. Are you safe? Are you fine?
Yes, I'm totally fine.
Okay, carry on then.
Okay, so there are many issues that have been promised to be tackled, and that is menstrual hygiene management. When we look at the girl child, the government planned to provide free sanitary towels to all these school-going children and all these young people, especially the girls themselves, but we have not seen any of that being done. And we are in the urban centers, but we're not forgetting our young people in the rural areas. The girls there, do they have access to clean water? Now that they're homes, do they have access to this sanitary where they need? Are they actually able to afford them? We need to look at that. Then the limited access to information. I think the government should invest in ICT to see that the youth, the young people are able to access SRH information. If there is a portal or anything they can do to provide this information so that if we have social media, if these young people need to consult or these young people need to look out any solution to any challenge, they can be able to access that information and also address the sexual reproductive health challenges they have. Then the limited access to the health facilities. We think more outreaches to the communities where these young people actually live. This should be actually demand-driven. If the young people, I sit Kampala, so if I say I know where which community needs this, he's saying I'll tell you they need this and that. So in consultation with me, I'll know an outreach in such a place will need this and this. So it would be very, very much appreciated if that is done. But we should not also forget that the fact that these people, the young people are home, there is increased dependency ratios. You find one person is the breadwinner at home, but then has a line of people they have to take care of. So this becomes a challenge. Someone it affects their mental health because if these young people are sexually abused at home, and this is where they are locked to now, whom do they talk to? Whom do they run to find help, to find the help they need? We need to also tackle that. In the end,
Maureen, we'll get back to you later because we can't see you. We can't see you, but thank you so much. These are conversations going on from the different hubs. And thank you so much, the ones joining us on the different digital landscapes and a part of this conversation. I want to appreciate Zana Nganga in South Africa saying that this is one of the biggest challenges you're facing as well in South Africa. Leaders are not coming down. I think we need to have this conversation. Greetings to my brothers and sisters in Uganda. And one from Namibia coming in from Nko. Oh God, I hope I pronounced the name right. Nkona Jemson. I hope I pronounced your name right. You're saying that the best way we can have this conversation is if we take this upon ourselves as youths to get involved. That's when the old people will understand that we are ready to take charge of this. Thank you so much. It's a global conversation and be a part of it. The hashtag is Ramna Third Summit, and then we proceed. So back to you, Doctor from the Minister of Health. Doctor, there are questions for you. I wish I could ask them, but my colleague Kemi is best placed to ask these questions because she's a champion in that.
Okay, Dr. Richard, what is the roadmap and the timeline for the scale-up of the DICAs across the districts? So if we have 18, and you spoke about 40 key districts, how are we going from 18 to 40?
Thank you again. Clearly, we have we've been moving quite well until we had the COVID hiccup. We are trying to reorganize ourselves and see how best we can move. But precisely, some of the 18 DICAs already in place are part of the 40, and some are outside that. But in our estimation, we are seeing that we shall be able to reach out to 50 daycares constituted. We want to do more if we get a little bit more resources. But this financial year that has started in July, we want to ensure that we have, by June next year, we have all the 40 high burden districts having functional district coordination, adolescent health coordination committees that are well supported and are picking the issues of young people. So, of course, there are other issues. As I earlier mentioned, we want to see that the issues that are being discussed in the daycares are really young people issues, coming through the channels from the schools, coming through the channels from the communities, coming through the channels from the service delivery points, especially our health facilities. So there are other activities that are geared or are focused on training. First of all, the service providers. As I earlier mentioned, we are also training the school senior women and men in these high burden districts. We are also training health workers in higher institutions of learning. We have the resources to do this. We are modifying the mode of training because of the COVID guidelines. We had already gotten the approvals to do this work. It's an aggressive engagement, but we are looking at how we can have modified capacity building programs to ensure that by the time the daycare is functional, it's also getting input from the surrounding structures. So the timeline is actually 30th June 2021. We must have our 40 in place and perhaps the 18. If resources permit, we could actually do more.
Thank you, Dr. Richard. Dr. Richard, please convey our thanks to the team that you're working with on this. Whereas I'm the moderator, I'm also into youth programming that I'm very passionate about. So I also want to take this opportunity to caution the teams that are doing youth programming and their daycares in these districts, work with them. This, we can't let them work and then we are also programming on the other side. So let us all work together. Norman spoke about partnerships, so I think this is a very good platform for us to also see those synergies coming together.
Absolutely.
I'll also caution the RMNCAH team to share on their platforms which districts these are, these 18 daycares, where they exist, for all of us to know and continue this outside this room, especially with ensuring that young people are involved more.
I totally agree, but just to quote the Dr. Richard said, if funds allow, we are going to pray for funds that they come through, because that's one of the biggest hurdles to that. Back to the religious.
For these ones, it's a commitment.
Commitment.
The funds are available
to
roll them out. That's why we have a very strict timeline to deliver them by that time.
Funds are available.
Yeah.
Round of applause, ladies and gentlemen. That's a good commitment so far. Now, back to the religious leader, the Right Reverend Archimandrite Constantine. How are the young people supported to harness the demographic dividend currently happening?
Thank you very much. Our organization, for instance, Uganda Joint Christian Council, Faith for Family Health, we are just advocacy organizations. And now we are working hand in hand with the government, especially when it comes to this, the insurance policy. We found out that it can help the youth very much. Issues concerning empowerment of the youth. We are trying our best to make sure that we advocate with the parliament. And by the way, we run at least we have parliamentary liaison officers who really tell us of what policies are coming up. And so we have we are in a constant engagement with the parliament. Now, this is out and in. When I look at the problem of the youth, the problems of the youth, and even in regard to this, the summit we are having today, it's beyond this. I'll give you an example. What will be the role of the youth and women in the upcoming elections? And it affects, I can deceive certain youth. We are misusing the youth during such a kind of situations. And you know someone who has nothing here is vulnerable. What would be the role there? As religious leaders, what are we doing? Our ears to the ground. And as Faith for Family Health, we have issues now which we are advocating for. As I told you that we are an advocacy organization. For instance, we have other issues. Some of you are from Karamoja, from the mining areas. And the youth there, what is happening to the youth there? And the teenage girls. We are there advocating already. Go to Hoima, those mining areas. The youth who are being manipulated. The problems of the youth are more than what we are seeing and what we are talking about today. And we are sitting on a time bomb. You know, sometimes I tell people that I belong to BBC, born before computer, and I'm a PO box man. And we should not take the youth for granted. It is a sin. We have to confess. These youth have to be involved in every program a priest, a bishop, or whatever religious leader is doing. That's when their voices will be heard. It is a shame that someone of 75 sits with another one of 65, 80, whatever, and leaves the youth. And the development of the youth, the development of this country is built on the youth. I can talk more and more, but thank you. That's where I can end.
Thank you so much, Right Reverend Achmandrit Constantine Mbonabinji. He is well-traveled when it gets to issues of reproductive health, and is a champion of health when it gets to the ground. We hope all this reaches other religious leaders, that in whatever sermon they're going to pass on to their crowds, to their audiences, to their faithfuls, some of this information is plugged into those sermons. I hope so.
So Andrew, before we go through our last round, I would like to ask another question to Dr. Mugahi. And I would like for you to tell us how the district councils are engaged in supporting youth, young people programming.
And very quickly, I wanted to interest all of us in this house. The parliament at district level is actually the district council. The district council is the decision-making body at the district level. So I want the young people in every district, and those who are listening to us, in any advocacy forum that they are trying to put up, to engage with the district council. The head of the district council is the chairperson LC5. But if we could have an opportunity where a slot on every council of 10 minutes, they are given an opportunity for young people to present what are the issues for young people. The youth councils have not worked. They do not do this on your behalf. The youth representatives are not doing this in council on your behalf. So if there is an opportunity for appropriation of resources at district level, if there is an engagement, it's going to be an engagement game. If we want to achieve the results that we want to achieve, if we want to move the extra mile that we all long for, at a subnational level, we need to engage. We need to engage as young people, but I want to encourage the young people to engage the district councils and specifically the political leaders to ensure that their issues are heard. Thank you so much.
Thank you very much. District councils are decision-making organizations at the districts, young people. It is not enough to say that you are not being heard. You have a role to play. And Professor had so much wisdom when he said mindset changing, accountability, and it is us who have to make the moves. He said it was a game. Just think about it as chess. You have to make a move as a young person out there. Andrew?
Well, thank you so much. A lot of more feedback seems to be streaming through. We just can't thank you enough. Thank you so much for being a part of this conversation. The ones on Zoom, let's keep the conversation going. Back to Medina, this is the last round we're getting. what is your commitment as Minister of Gender, Minister of Gender, Labor, Social and Development for 2020-21 for improving the SRH for the young people at community level?
Thank you so much. The ministry, we are really committed to seeing that the young people receive the services that they require. At least during this COVID time, we have continued to support families. Everyone is talking about family and the capacity of parents to talk to the young people while they are under lockdown. So this is an ongoing activity as the Minister of Gender. We are, I don't know whether I should call it empowering or training the parents to talk to, how to talk to and engage the young people under their custody, especially providing information that is age appropriate to the young people in their custody. And this has been really hard because you may testify that even us here, the parents in this house who have young people, sometimes they are challenged on how to talk to them. You talk to them, they are not opening up, and you don't know how to get them out of that kind of situation to let them open up to you. So that is one of the programs we are currently implementing at family level. And now, another thing is that we are putting much our efforts to work with the Ministry of Health to help us in the area of drug and substance abuse. Through our monitoring activities, we have realized that many people are scattered, or partners are scattered in areas of livelihood, in areas of sexual reproductive health, but the issue of drug and substance abuse has not been given much attention, and yet it is causing so many problems still around sexual reproductive health. So that is another area of our intervention. And then also engaging more the district community development officers, the probation officers. We have a program of professionalizing youth work. And professionalizing youth work, we realize that each one of us, everyone thinks they are the experts in providing youth services. And at the end of the day, we don't know what kind of information is going out to the young people. So we have a program to professionalize youth work. And we call out to all organizations that have youth workers to refer them to us so that we fine-tune them for them to be tailored to providing services to the young people in a professional manner. And this one will still go to Ministry of Health, where we are working with them to providing youth-friendly services. We found out they have adolescent centers and so on, but the feedback we were getting from the young people they serve are related to how friendly these services are. So that's where we are.
Thank you so much, Faith. In a minute, what is your commitment for 2020 and 2021?
Thank you so much, Andrew. As I say my commitment, I want to tell everyone else there that, or even my fellow panelists, that I am a product of meaningful youth participation. It's because of being engaged. I was just a peer educator in my UK, and here I am speaking for. So if I'm just an example that if young people are given opportunity and capacity strengthened, they're able to represent their issues. And that gets to my commitment that as an advocate, I commit to continue speaking out for the issues of young people that most affect them, but most importantly also to ensure that we do not bring young people in spaces and we do not involve them meaningfully. So as a young person, as an advocate, I will mentor young people out there, but I will encourage the structures that are available that, yes, take up this to mentor these young people so that we move forward as a country.
Thank you so much. Right Reverend Archmandriate Constantine Mbonabinji, from the religious perspective, what could be your commitment as you're winding up?
One, we are committed for this, for us
Your mic, Reverend. Okay.
Yes. For Faith Family Health, we are committed to helping districts develop DCIPs, which will be friendly also to the youth. Two, we are, as religious leaders who have hospitals and schools, we are committed to offer some sexual, some HR issues really which are friendly to the youth, putting into account our values and our doctrines. But my issue remains to not be business as usual. COVID has opened our eyes. We should plan, and we must plan for the youth, and they need to develop, and they need to stand up for this country and for Africa.
Thank you so much, Reverend. Doctor, as you're winding up, Dr. Richard, what is the commitment from the Ministry of Health? Because this entirely hinges on the ministry.
Thank you, moderator. Our commitment is within our mandate, but we are ready even to move an extra mile. We commit to train more health workers, to build the capacity, specifically regarding the handling of young people in offering sexual and reproductive health services. This is something that we are working on, and in the next, perhaps, platform meeting, we shall give the numbers of those we have trained. We are also committing within our mandate to provide technical guidance to all our stakeholders. We have an adolescent health policy almost coming through, but it may have to wait for another parliament.
I hear you.
We have a number of policy documents. The school health policy is also has also missed. And in all this, we think we are going to guide our young people to learn the proper skills of advocating. Unless we train the young people at the different levels, at district level, to learn how to advocate and learn how to engage. Because the people we are sending them to are not their peers. They'll go there and begin saying, this is the real deal, let's engage. But we need to teach them how to package their issues so that their issues can gain prominence and their issues are addressed. Thank you so much.
Thank you so much, Doctor. Thank you so much, panelists. Let's give them a round of applause, ladies and gentlemen. The next session, and the ones who have been watching us live on NTV and on the other platforms, I want to thank you so much. Thanks so much for being a part of this conversation. Let's find lasting solutions to these issues that are within our communities, and each one of us has a role to play. The next segment or the next engagement, it's going to be handled entirely by my colleague Kemi Gisha to take us through on the floor what are the parliamentarians here suggesting, what is really happening on ground with regards to the assistant cow as well, giving us insights on how we can go from here. Kemi?
Thank you very much, Andrew. Thank you very much, the panelists, for speaking with so much grace and reassuring us that we will go forward and in a better way. We thank you so much. So we are going to hear from the assistant cow from Budaka district, one of the districts that already has a DICA. Does he have the mic? Okay. Thank you very much for coming, Mr. Chitutu Frederick. I would like to hear from you how the DICA is facilitating delivery of SRH services to the young people in Budaka district.
Thank you very much. First of all, I'm not Assistant Cow. I'm Deputy Chief Administrative Officer, Budaka District. Now, one, that this committee has not been there for a long time. We started in 2019, May, and the person who had been chairing was the chief administrative officer. But because of engagement, he assigned that responsibility to my colleague, who is now in Kamwenge. By then I was in Ngora district, so I took over from there. Now, what are we doing? The first thing that we have been doing is collaboration. The doctor has just talked that there is a draft policy of the composition of membership. Now, Faith, while making a presentation, of course, she was concerned that younger people are being left out. But through our collaborations and engagement with the different stakeholders, including religious leaders, including the youth representative, our committee, we co-opt a number of people to help us handle this problem of young people. We have not got statistics currently, but I can assure you we have done the short time that we have been we have been holding meetings and doing advocacy and collaboration. We have done a lot. For example, in all our health center threes, apart from one, that is Ikiki, all had youth-friendly corners. The pandemic has somehow affected us, but they were functional. That one, Naguru Teenage Center can testify, and they have been there. What we have been doing is to look for more support, technical guidance, because they are more technically empowered to assist us. The other issue that we have been doing is integration of the budgets across departments and sectors, including works and technical services. Originally, the engineers thought that how does reproductive health, how is it connected to water? We said, but you are putting a water source, and the main people who collect water are these teenage girls we are talking about, who get pregnant, they are laid as they go for water. Even the young boys are the ones who collect water, in most cases, in the rural areas. So, through the integration of our plans, if you look at the budget for 2021, we will find at least there is some slot of some little money that is geared towards these younger people, from both their reproductive health. Then the other issue is we have come up with a roadmap of how best we shall be handling this issue amidst the pandemic. For example, we are looking at having small community dialogue. Of course, in collaboration with the district task force of COVID, we are coming up with a mechanism of how best we are going to handle this. Lastly, we are also seeking a lot of support from council. The council, all the social services committee, the entire council, once you present any issue related to youth, people have, all the previous speakers have been saying it is a time bomb, it is a time bomb. I can assure you, once you bring any issue, they take it as long as it is very useful and it's going to help these younger people. Thank you very much.
Thank you very much, Mr. Chitutu. Pardon me for the mistake on the title. We appreciate your efforts as a district, and we see that, so the discussion has come to it, what is happening in the district. So we appreciate the efforts that you've put in place. Can you tell us what your commitment is going to be to improve SRH for young people in your district?
One is making sure that all sectors across the board, they have to allocate some resources towards that activity. Two, we want to involve these youths, these young people themselves, into the planning process. Yeah, they have representatives. Somebody said that sometimes they don't speak. But there are other forums through which these young people are free to speak their mind. We always hold budget conferences. We always hold budget conferences, and unfortunately, I don't know whether they are not aware, but it's always open. You are free to contribute and influence, because everything hinges on resources. So that is an opportunity for these younger people to participate. So we as a DICA, in the next circle planning, which is beginning in October, we are going to make sure that many of these youths are involved. That one is a commitment that we shall not debate about it.
Thank you very much for that commitment. We are going to hear from the Honorable Member of Parliament, Honorable Bagole. Pardon me if I mispronounce it. But Honorable Bagole John, I would like to have a conversation with you. Does he have the mic?
I have one.
Okay, thank you. So, in terms of the role of the Parliament in accelerating the scaling up of the DICAs, what contribution is the Parliament making in representation of young people and their adolescent issues?
Thank you very much. My name is John Bagole Ngobi. I represent Luka County North. I would like to apologize for coming in a little bit late, but I was caught up by jam. And at the moment, politicians are scarce. Some of us who are in Kampala, you can only see the flesh, but our hearts are in the constituencies.
Very understandable.
But I want to welcome everybody. I want to appreciate the panelists and everybody who is listening to us. I came here purposely to reaffirm. I am not the spokesperson of Parliament, but I'm a member of Parliament. I've been there, I am there, and I think I'm planning to be there for the next coming 10 years, I think. That's my wish. But for the time I've been in Parliament, I came up with a personal commitment, because I've ever been a youth, and I think by the time I joined Parliament, I was almost still a youth, because I joined Parliament at 36 years. Currently, I'm 46, but most of my friends are youth. But the panelists who were sharing with us were telling us quite a good number of things, and I don't want to repeat again what they talked about, but there are some few issues that they left out. The challenges that the youth are having, I think some of them are emanating from the angle of technological advancement. Reverend was saying that for him he was born before computers, which is true. I think even some of us who are in our early 40s were born before computers. But much as, according to my personal research, much as the families, some concerned families really sit with their children and they speak to them. I always tell people that I was, and I am very, very, I think, lucky to have been born by a very poor peasant parent or parents. They used to talk to me whenever we'll have food. For us, we used to sit on the floor and round up the food and then we eat. But as we were eating, they were telling us stories, but at the same time scaring us. And out of that kind of scaring, I think I had my first sexual intercourse when I was 36 years. It's unbelievable, and people don't believe it, but it's true. But today, with this modernization which is coming with technological advancements, people having sex at 11 years or even 10, they are doing it. We have moved around the country. I am one of the executives on the Parliamentary Forum on population, food security and development. And the Population Secretariat gave us a role of trying to see how we can help them to handle the issue that the young man was talking about here, harnessing the demographic dividend. We are trying it, but we always get very, very, very heartbreaking stories from the youth. They go to the internet, they learn these things, and for them, what they want is to put it, to try it out and see. I did a personal research a few weeks ago. I always go to test for RBS. That's random blood sugar and at times HIV. But I befriended this young man who was in the laboratory, and I was asking him about the trends, the positive trends out of the tests that he was doing and the negative trends. But to my surprise, the young man was like, you see, we are not supposed to disclose these issues. But he said, since you're Msoga and I am a Msoga, I will tell you this. The biggest percentage of positive people are the first years and the second years of girls at campus. Can you imagine? The young people who are here, I know you were here before me, and I did not come here to tell you stories. But much as we are talking about early marriages and teenage pregnancies, AIDS is still there. And it's killing people even more than COVID. But some people don't want to believe that. And with the AIDS, once you become positive, you will never be negative again. But with the COVID, you can be positive here today, but when you go back home and take lemon, the next day you'll be negative. Therefore, back to the issue of the role of Parliament, I want to reassure the young people, but we have one challenge that Dr. Twine did not talk about, and some other panelists, like my friend here from the Ministry of Gender, Social, and Labor kind of things. Uganda, as a country, using my elementary economics, we have some money, but the money we have is little. We cannot compare ourselves to these other developed countries. For us, when we are budgeting, I sit on the budget committee. We budget and we channel the money which is supposed to help the youth through the Ministry of Gender, through the districts. But there is very little impact. My sister was talking about the probation officers. In some districts, the youth there don't even know about probation officers. They don't. And even in some districts, let me give an example of my district of Luka. The district has been there for the last 9 years. But the District Service Commission only sat of recent to recruit a probation officer. But the District Service Commission gets a salary, a very serious salary. When this one expires, they nominate others to come up and do the job of recruiting officers who will help our youth. Those are some of the challenges. Corruption. Even the little money that we channel through those agencies to help our youth, the money is eaten. The money is stolen. It is not there. I don't want to go deep into that issue. The president has been singing the song to the extent that it was almost becoming a national song, a national anthem, sorry to say so. But right now, I hear he has deployed in Nakalema, and Nakalema is trying she's also trying to do what she can do. And my prayer is that God may help her to be able to do it. I know you're looking at me because there is no time, but I want to end by reaffirming to you that Parliament is very, very committed through the official channels and through the forums like our population, food security, and development, maternal health, Naum, and there are many. We always move around on our own at times. There was even a time when I offered my vehicle to go to Karamoja and do a survey to find out. We went to Bukwo when those guys there were circumcising girls, and we were sensitizing people about these issues. So that is our commitment. We shall budget the little we have to make sure we reach there. I hear oil is coming, and very soon Uganda will be a middle-income status country. I think we shall handle more than what we are doing now. Lastly, there is one thing that I cannot forget to talk about. The youth, all these young people have leaders, and they always democratically elect them. But to my surprise, some of the leaders of the young people are of my age, 46 and above. The reason being, politics has been commercialized. The very young person cannot afford to conduct a campaign to be voted for. So somebody of 45 years or 50 comes up and tells them that, you see, for me, I'm still a youth, I have some money. And the youth will line up behind him, and they will vote for such a big person. But at the end of the day, they will fear to go to him and tell him their problems, because after voting for him, that's when they realize that that person is big. Thank you very much.
Thank you very much, Honorable. First of all, I was looking at you because you were speaking. And then, and then on top of that, there are so many issues, of course, that we can, when we get an opportunity to speak to an honorable, we have very many issues, and I'm sure the young people here will engage with you and the honorable ministers that are, parliamentarians that are available. I would like to further ask you for your commitment. You have mentioned that you would like to come back to the parliament, but if you come back, what are your commitments? Whether in or not, or out of the parliament, what are your commitments for 2020, 2021 regarding young people's sexual reproductive health issues?
My commitment as a parliamentarian, I promise that given us a chance that I'm still on the budget committee, when it comes to budgeting for the youth, I'll make sure that I re-emphasize for that vote to be given more and more, considering what the resource envelope will be permitting.
Thank you very much. We were told about the district councils, so I want to encourage you. I could also ask if you have played a role in that area regarding young people's reproductive health issues for Luka, but also to encourage the parliamentarians that are here to move forward with these urgent issues.
To be sincere, I don't want to lie. I've tried to move around, but you see, the work of parliament is a little bit tricky at times. A member of parliament from Luka will go to Bukwo, and a member of parliament from Mbarara will go to Luka, and a member of parliament from Bukwo will go to West Nile. But as we are moving like that, we are always transmitting the same voice, and we are always directing our issues towards a common goal. So much as I did not personally go to Luka, but some of my colleagues here, like Honorable Nuat, I saw her there. She was at my district of recent. The State Minister for Health, Honorable Nabanja, was there last week, as I was in Gulu, also trying to do some parliamentary work there. So we shall do that, and we shall be able, but everything rotates around the budget. That's why you were hearing from your brother, complaining about the resources, if the resources permit. So I'm privileged to be on the budget committee, and I promise that I'll be able to re-emphasize the issues of youth and our mothers. Thank you.
Thank you very much, Honorable. I would like to also call the Ministry of Education. Good afternoon.
Good
Mr.
afternoon.
Semakula.
Good
Henry.
afternoon.
Please speak to us about the role of the Ministry of Education regarding moving forward the agenda of young people, discussing their issues at the grassroots levels.
Okay, thank you very much. I think I wasn't on program to speak, but I'm a participant. And since you've decided to pick on any participant, I want to thank you so much. My name is Henry Semakula, and I work with the Ministry of Education. I do a lot of work around adolescent health. I just want to have quick comments. Many people have indicated that the lockdown has had a very big challenge to our children when they are home. And that obviously emphasizes the much work, the too much work on adolescent health that the Ministry of Education does when the children are at school. So I want to pass that voice and make it very strong, because in many fora, we have been accused of doing nothing. Now we can sense that indeed what we do really has a lot. Just to remind us that while they're at school, our senior women attend to them, our senior men attend to them. We have teachers in charge of guidance and counseling. We have programs based on clubs. We have support from so many CSOs, including those whose faces I see here. So we have also, as a ministry, on many occasions, organized symposium to discuss issues of violence. We have been right in charge of organizing the International Menstrual Hygiene Management Day, which are all issues around adolescent health. Now, the second point I want to point out goes to the Reverend, and I want to thank the Reverend so much for participating in this summit. As a ministry, you heard that we had a sexuality education framework that we actually developed, and the key purpose was just about which information can we give our young people that is age appropriate, that is culturally acceptable, that is religiously acceptable. And it all rotated around the issues we're actually discussing here. So I want to inform the people at this summit that Ministry of Education is working so well with religious leaders, are aware of the fact that they may not own now, but they are the main founders of majority of the schools in Uganda. So we believe so much in them, and we have worked with them with the fact that we know they are very, very responsible. They hold very high influence. Reverend here, with due respect, if a reverend told a village not to do something, that village may not do it at all. The same respect goes to the cultural leaders. If, for example, my Buganda king said all Baganda men come without shoes to town, we may come without shoes. So we believe in cultural leadership, but we also believe in religious leadership. We know they are listened to, we know they are respected, we know they are highly knowledgeable and very, very involved in research. So, Reverend, I just want to add my voice onto those others who must actually believe that the religious leaders have a role, but also to use this forum to request you, Reverend, as you get back to other members of the religious community, to really give us support as we advance the sexual education step framework. Because somehow we got stuck a little bit, and we are re-engaging the religious leaders so that we come to a common voice. The other issue I will say very quickly is that somebody has talked of meaningful participation of the young people, and I also want to add my voice. We've seen scenarios where young people have simply been invited to come and sing, to come and dance, to come and be ushers. I think that is not what we mean by the meaningful participation. They should be on the same table to do what the adults actually do. The PS earlier indicated that she wishes to see that moment when all of us are doing the same things around adolescent health. Same programming, possibly using same resources, doing the same activities. But as a person from a sector that handles children at school, I'll say that we can only have sector-specific activities. Because for us in school environment, for example, we cannot allow any service around reproductive health to be provided at a school level. Just a quick example, we can't allow a condom to be distributed at school, but we can do all the other bits of work that can be done by others. And finally, as a sector, we've also contributed in the lockdown. We have sent the materials you've had. The e-learning is going on. We are preparing for reopening. We have got guidance from Minister of Health, and we hope we shall be there. Thank you.
Thank you very much. Just to add to what you are saying, or to supplement, when Dr. Dina spoke about, Dr. Diana spoke about one program, it could be one program that has the same blueprint, but has different, say, roadmaps. So we could have one big program for young people, and then when it comes to schools, we have just what is specific for the schools. But I believe in her dream for us all in our programming. I want to thank you so much for your presence. I thank you so much for participating. I want to thank you so much for participating. The people that are online, thank you very much for your time and MBs, and also sharing with us. The people that are here, we thank you so much for your presence as well and paying attention. I want to thank very specifically the members of parliament, the representatives from the different ministries. Before I came into health, I was in agriculture, and we had the same issues. We were having the same, what is happening now? We'll talk about how do we get young people to grow coffee, how do we get them to stop selling land, and and we're talking about young people. So I think what we can do next time is also to have other ministries here, because they're also dealing with young people, respectively, beyond just reproductive health. Other than that, I would like to ask Winnie to come and give us the next steps, and then also we will have Dr. Mugahi close out. And as I said earlier, Dr. Mugahi is like our big brother in this conversation and on this journey, and we thank you so much for your time that you continue to place aside for technical guidance to the teams in respective organizations. Winnie, are you ready? Are you Winnie? Okay, we will have Joshua give us the next steps.